the Connecticut Health Policy Project, we're very honored to be co-sponsoring the forum. We are a nonprofit. We do advocacy statewide. We're based in New Haven, but we work on behalf of people all over the state. And we work for people who don't have insurance. And a few years ago, that was really simple. You either had it or you didn't. Now there's a whole gradation of having it, but having crappy insurance that doesn't pay for anything and doesn't cover anything you need. And I represent those people, and those people are growing. And Waterbury has an awful lot of them. And we're very concerned about access to care with the merger, and for-profit healthcare doesn't have a great record in other parts of the country in terms of providing care. And I don't go anywhere without doing statistics, so I'm going to bore you for a little bit, but try really hard not to glaze over. Legislators are all like, yes, she does. But patients are more like, this is really simple. Patients who go into for-profit hospitals are more likely to die there than in a nonprofit hospital. For-profit hospitals cost more to treat patients. It just makes sense. They're paying taxes, they're paying for profits, and they're paying for care. That nonprofits don't have all that extra overhead. It costs more. They try to maintain their profits when times get tough, and we all know that healthcare costs aren't going down. They maintain their profits by cutting back on staffing, which is strongly correlated. I mean, is the reason that people die in hospitals, because there are not people there to take care of them, not enough beds. They provide worse quality care, and nonprofit hospitals provide better quality care and better health outcomes across all diseases from congestive heart failure to heart attack to pneumonia. I could go on. Studies have found that, this is interesting. Studies have found that for-profit hospitals choose which services they're going to provide to a large extent. They cherry pick. For-profit hospitals pick off the services they make the most money on. They're a for-profit business. They're taking out profits and sending it to Wall Street or Texas or wherever, but they're not keeping it in Waterbury. St. Mary's, I looked this up just this morning. St. Mary's made in profits last year $13.6 million last year. And Waterbury was profitable for the first time in 4 years. All that money stayed in this community last year. Next year, any profits will go outside this community when it's for-profit healthcare. It'll go to stockholders. It won't go back to patient care. And last year, the two hospitals provided between them over $10 million in uncompensated care to my clients, to people who are uninsured and underinsured. There were 400 discharges between the two hospitals of people who didn't have insurance. We need to know that those people are still going to be able to get their care, even though they're taking out profits from the hospital. What assurances are there that that's going to happen? If anybody wasn't worried when they walked in this room, you should be really worried when you walk out. Because even if it isn't you, even if you have insurance, it could be you tomorrow, and it's your community, and that's money that's coming out of your community that's not going to pay for the care of your neighbors. That affects everybody's health care.
Thank you.